Do you have any guilt?
I had nothing to do with these vaccines.
Do you work for the CIA?
They don't realize that I took a lot of risk in disclosing these things that I know. The investment that the United States government made in biowarfare research is larger than the investment they made in thermonuclear weapon research. I mean, this is the basis for my work in psychological warfare. I'm pretty convinced that I got used. These guys are really good at lying. You got to understand, if you're dealing with anybody in the intelligence community that are operative, they are trained liars, trained psychological manipulators. That's what they do. Well, this looked like it was an engineered pathogen. And these people are absolutely out there.
I just assume you are CIA.
And I was not going to just sit by and let these guys have their way with all of us.
I have known that they want every adult lining up for vaccinations without question. If mRNA comes as a tidal wave, they can start vaccinating for every bacteria and virus on the planet. They can convince you, get the government to mandate it. There's gonna be a pandemic. They've got to get all of you to believe you need a vaccine. It's not about the kids already vaccinating them. They want you. Dr. Robert Malone, I want to thank you for joining the Maha podcast today.
It's my honor, Del, and thank you for the invitation.
Absolutely. I mean, you're at the top of the list as soon as I decided I wanted to do this. You and I have had many private conversations about Maha, really. I mean, even before there was
a Maha.
Maha was a Maha, or we were Maha. But in your mind, when someone asks you, because you're getting asked this question a lot, you've been an advisor to Bobby on many levels, but what is Maha? How do you define it to someone that's asking?
So let's start off with the acronym, Make America Healthy Again. And when I'm hit with that kind of a question of what is Maha, what's the agenda, what do they hope to accomplish, those kinds of things, I'm not part of Bobby's inner circle, unlike yourself.
Uh-huh.
And so I can't really represent what Maha is as it's structured right now, what that initiative represents. I can only look at the artifacts and things that people have said. So what I always start with is that it involves a focus on redefining, in the context of the federal government, redefining the orientation of most of the HHS R&D and scientific enterprise activities from a disease-centric focus to a health promotion focus. And that seems like a trivial statement, but it's profound. And it underscores what's, one of the fundamental problems associated with how HHS R&D and other activities are structured. I'm talking about CDC, FDA, NIH primarily, not CMS, Medicare. I think it's good that Bobby selected Dr. Oz, and he's going to be able to have an experienced hand running that operation. And I'm glad that Bobby isn't going to have to focus on it so much, because that is a beast.
Yes.
But getting back to these more R&D and historically drug-focused operations, they're siloed in the extreme, and it's a major problem. This focus on drugs and treatment of diseases has led us down a path where all of these activities are parsed into increasingly fine divisions, led by people that operate within that division. So notoriously, if you want to get funding for a project, let's say, for instance, you want to develop better, safer ways to deliver RNA. Just imagine that somebody might be interested in that.
Someone might want to do that.
And in order to do that, you would have to pitch the research program that you want to engage in the context of a specific disease like cystic fibrosis or a vaccine or whatever the particular thing is. You can't pitch it as a broad initiative that would enable a variety of different outcomes. It's just not the way NIH is structured. And this has led to kind of a strange myopia.
So ultimately, it's gonna be a million studies for a million different things mRNA could do.
Or as
Is that what you're saying?
just staying with that within that example, if you want to get capital, you want to get funding, because that's really what it's all about in modern biomedical research. You have to pitch your insight or your opportunity or your thrust into the context of a specific disease, cardiovascular disease or kidney disease or whatever. You can't.
This is what we're going to cure.
Right, precisely. So it's this disease-centric focus. And that also, in parallel, you have the CDC that's largely structured, again, around disease-centric initiatives. And people aren't aware generally that CDC has a very strong R&D component that overlaps significantly with the NIH. There's a lot of mission creep in all three of these key agencies, FDA, CDC, and NIH. And overlap, this results in bureaucratic fighting. And of course, the FDA is siloed on exactly that kind of structure. So there's a cardiovascular division, there's a pulmonary division, et cetera, et cetera. And each of those operate like their own little fiefdom, which is a major gripe for small to mid-size pharmaceutical developers is they don't necessarily know what they're going to encounter. So the point is, I've kind of gone off into the weeds.
Yeah, no.
The point is that
it work? What is Bobby up against? Is what you're talking about.
That's a bigger.
But we'll get into that.
That's a bigger question.
Let me leave you on track here.
Yeah. So what I'm trying to express is that trying to help the listener understand that while this may seem like a subtle distinction, transition from a focus on disease and disease silos to a focus on health promotion is a profound change, because health promotion involves identification of things which can act in a broad sense to advance general health. So when we talk about chronic inflammatory disease and obesity are two of the major problems that Bobby is explicitly going to be taking on, specifically also within pediatrics, child's health. If you look at the president's executive order in establishing the MAHA Commission, that order has very specific items. Not mentioned in there is the mandate that Bobby has to show demonstrable improvement in measurable metrics for citizens' health within 12 to 18 months.
Is that possible?
Absolutely. It depends on what the metric is.
Okay.
And I've been making the argument that he's inheriting a situation that it's a mixed message, but is already going to bias him towards success, and that's the use of these GLP inhibitors like Ozempic, which is having an impact on the obesity epidemic that we have in those cohorts that are able to access that drug. It's very expensive, and I think that there will be measurable improvements. There's a lot of controversy about Ozempic and the related drugs.
You're stepping right on what I would say, behind closed doors really is I don't know if it's a third rail. It's the complication. It's the open wire that everyone's grabbing. A lot of people are telling Bobby, and first of all, Cali Means has really come out against Ozempic, especially this idea of having like everybody that's $5,000 in the Medicare Medicaid system. Let's throw them on it. Let's lose that weight. But there are a lot of people very close to Bobby, I will say, and I'm just I won't name names, so I think I'm safe to say it, but saying to Bobby, if you really want to show a marked difference, you've got to embrace these GLP-1s because they're going to reduce it, and there's lots of arguments, right? Let's just look at the extreme cases of obesity, bringing them down. I mean, that's going to, and what people need to realize is that the sicker the person is that you reverse, the more effect they're going to have on your overall stats, right? Getting you and I to lose 3 or 4 pounds, which, I probably need it. You're looking pretty good, but it's not going to do a whole lot.
I've dropped 50.
Yeah, you look
I've dropped
great.
50 over the last 2 years.
Do you use a GLP-1?
I do. I haven't disclosed that previously.
Interesting.
But also major dietary change and
Yep.
lifestyle change. We've really cut the carbs out. My wife and I were like 3-decade vegetarians,
Yep.
but increasingly had come to rely on these ultra-processed soy-based products.
Yeah.
And I had pro-inflammatory syndrome. Absolutely. I had all the classic markers. The whole situation with the COVID crisis in which I had long COVID from getting infected in February of 2020 with the original strain. And then I took 2 doses of the vaccine, unfortunately, Moderna, and the second dose, I got one of the bad batches. And this is really before we knew what we know now about the full spectrum of adverse events. And I had a lot of those classic events, including cardiac damage and POTS syndrome, restless leg, and a number of other adverse events.
Yeah.
And so the consequence of that was, between the two things, the long COVID and the vaccine damage, I really couldn't work the farm in the same way that I could before. I just didn't have the stamina. So I'm sitting around more, writing all the time, doing podcasts, a lot more sedentary, in a high-stress situation, traveling all the time. And both my wife and I put on weight and got less and less healthy. And fortunately, hooked up with a non-traditional physician, a primary care physician that lives nearby to us, Brooke Miller, and who happens to also be an Angus rancher. And Brooke was adamant. You guys, I went to him and I said, okay, Brooke, everything's on the table. I'm not doing well. Tell me what I need to do. And he did the blood draws and looked at my inflammatory markers, et cetera, and concluded, he said, Robert, you have got to change your diet. And I really strongly recommend that you start eating beef and cut out the carbs. It worked.
So you did, after years of being a vegetarian,
Total
you
flip-flop.
flipped over to eating beef. Was it hard? Was it a hard transition? Let me ask you this, because I was a vegetarian for years and years and years, and ultimately I recognized I was a junkatarian. I'm eating a lot of pizza. I'm eating bagels,
precisely.
cheese,
Totally addicted to Italian food. Yeah.
And so, what good is that really doing? But were you a vegetarian for ethical reasons? Like, did you have a real issue with eating animals, or was it just more a health decision?
No, originally, so Jill and I are both long-standing people that are committed to ethical choices. Okay. And also, Jill was a zookeeper at both the San Diego Zoo, Wild Animal Park, and the Brookfield Zoo in Chicago. So we've always been around animals. And so we take that, we're people who believe in ethical treatment of animals and humans. And so the logic of eating lower on the food chain, combined with the logic of not eating animals, not preying on animals. And I like to say, if mice have a place in heaven, I'm toast. I'm going straight to hell because of all of the animal research work that we did for many years, which we don't do anymore. And so it was that kind of mixture of things, the ethics of eating lower on the food chain, having less impact on the world, and respecting life. It's really what it comes down to.
Yeah.
But I guess time passes, you get older, and when you're facing the issue of whether you're going to be able to be healthy or continue along this path that was clearly not healthy, then I think the decision we made under Brooke's guidance was to go ahead, but to do everything we can to assure that those meat products that we're consuming are ethically sourced.
Yeah.
So we do eat a lot of eggs. I have a bunch of the roosters that Jill and I killed and processed that came off of our own egg hatching last year, still in the freezer.
Just because like Henry and June and Chuckles, you can't name them, so they're stuck in the freezer. Can't eat them yet, or
well,
what's the delay?
We don't name our chickens. We do not name our chickens. That's a rule. We name our horses, but we don't eat our horses. And then we get locally. We're fortunate in Virginia to have good access to locally produced grass-fed beef, and we like to buy direct from farmers to the extent possible. Because that way we can be assured that we can see and we know the people that are caring for the animals. We know that they take care of them, that they are managing their herds ethically. It's a lot harder when you start talking about poultry if you're buying poultry in the supermarket.
Yeah.
We have our own eggs, et cetera. So we're trying to move even more in that direction. Jill has plans. It turns out that mini jerseys, we've had mini jerseys before, mini Jersey cows. Mini jerseys are actually a practical thing for a breeder. We've been breeding animals for a long time, and horses primarily, also dogs. And we used to have mini jerseys, but we just ended up with way too much milk and we were getting fat. But we're going to go back to that and try to get some cows.
How big is a mini Jersey? Is it? Is it?
They're kind of hip high.
Really? That?
Yeah,
wow.
they're smaller, and you can get them A2 now. So that's the more digestible milk.
Yeah.
This backstory is that the island of Jersey is kind of rough, windy, stormy, and the cows that came off of that, milk cows that they kept, were stunted just because of the genetic selection in that harsher environment. And then they were imported in the United States, and American cow breeders heavied them up to get the big jerseys with a huge milk production.
Yeah.
So that's the Jersey that everybody thinks about, a real high butterfat, et cetera. But those old jerseys back from the source have given rise to this breed that has really gotten popular among homesteaders like ourselves, and small farmers, hobby farmers, they call them. But increasingly, these are people that are, like us, committed to a lifestyle in which they're more self-sufficient.
Yeah.
So
where are you at with the raw milk thing? I mean, it's shockingly controversial, I find. I mean, like the media makes a big deal out of it.
So is fluoride, right?
Yeah,
and
true.
the data's in on fluoride.
Right.
Okay, so that we've done multiple deep dives into the raw milk thing, and we're personally absolutely okay with raw milk. And we were consuming raw milk straight from our own cows that we were milking on a daily basis for a while when we were in North Georgia. And I'm sure if we get back in the mini, my wife tells me she's put a deposit down now, so we are going to have some mini jerseys.
You're going in.
Whether I like it or not, it's going to happen. This historic story was that the justification was that there was a risk associated with bovine tuberculosis, and that the bovine version of tuberculosis was contributing significantly to human tuberculosis. So this is another one of these zoonotic infection stories.
Okay.
Like
I've never heard this.
Like what was told to us for the origins of SARS-CoV-2, that turned out to be fraudulent, I think we can call it now.
Yeah.
And also that's the justification for all the fear around the bird flu. Is not that bird flu is killing off hundreds and hundreds of dairy workers that are getting it from milking cow, right? There's no sustained human-to-human transmission. There's no significant disease or death associated with H5N1, but still the fear is just constantly pushed by corporate media. And if you unpack all of that, the fear that they're promoting is that, well, this might at some point jump from birds into humans. And if so, in the few cases where humans have been infected and they've come to the attention of the WHO, Bob Redfield cited the statistics of 50% case fatality rate for bird flu, according to the WHO. That's false. That's a data artifact. Because for a case to be reported up to the WHO, it's got to be a serious case. And so WHO has kind of an intrinsic selection bias that leads to that 50% number. But you can see the reality if you look at the data from the United States. There are over 600 people that have been infected with bird flu. They mostly get conjunctivitis, in other words, red eye.
Yeah.
And they rarely go to the hospital. There's 2 cases now that are asserted to have died with bird flu. Remember that story with COVID?
Yes, of course.
Okay.
The old trick.
So 2 cases.
The car accident had nothing to do with it.
Right, or the gunshot wound. And there's for instance, the guy down in Louisiana they made so much of hay over. Older gentleman, heavy exposure to carcasses infected, and significant pre-existing conditions. Where we heard that story before.
Right.
So getting back to the cows and unpasteurized milk, the logic was that bovine tuberculosis, which absolutely exists, was a risk factor for human tuberculosis. But it turns out that Mycobacterium tuberculosis in humans is a different species. It's related, but the bovine tuberculosis rarely infects humans. So, but it's another one of these stories like the Spanish flu that is spread around kind of like a boogeyman was used to scare us into compliance with our annual flu vaccine that most countries don't require.
Yeah.
But the same was done with bovine tuberculosis. And at the time, we can say that it was out of ignorance. And it was a reasonable hypothesis, but like we've seen happen with the science again and again, hypotheses in the hands of bureaucrats seem to often transform themselves into edicts and into a religion. That's
exactly
the
right.
religion of scientism.
Yeah.
And so the same thing happened with bovine tuberculosis. And then once it's established, that is the storyline in public health, then it gets propagated forever. And it's very hard to
point out the
overturn
irony
it.
because, I'm not a scientist, but I've interviewed enough of you guys now. And when you think of Edward Jenner, I mean, there's an irony here because Edward Jenner makes this conclusion, the father of the smallpox vaccine. Hey, look, the milkmaids aren't getting smallpox. Maybe it's because they're coming in contact with cowpox. So I find it interesting that nobody you could have easily had a hypothesis that drinking bovine, tuberculosis, maybe could that create an immunity that would be protective to, human tuberculosis. Couldn't you? I mean, you could, if I'm going to just think of a theory, why is that, or a hypothesis, why is it not in there?
Whether you actually are aware or not, you've now blundered into a domain that's really interesting because the tuberculosis vaccine that's used globally.
Yeah. BCG or?
BCG.
Yep.
What does BCG stand for? Bovine. Calumet Guerin. Okay. So it's an attenuated bovine TB, and it is administered as a vaccine in many places in the world. And there's some really odd things about BCG vaccination. Is it really protective against human tuberculosis? That turns out, I worked for the Eris Global TB Vaccine Foundation back in the day, which is one of the first, the slang is gatelets, nonprofits funded by Bill and Melinda Gates.
Yep.
So that's where I learned about the nature of BMG, and the founder of Eris kind of trained the Gates Foundation on the way that Merck does business because he'd come from Merck, and that's a whole nother threat.
This could be a 15-hour interview, so we'll try and...
So the fascinating thing about BCG is that people that are vaccinated with BCG or potentially treated with BCG, because it's now being used as treatment, it's effective for bladder cancer, and it seems to have a protective effect against breast cancer that is a little paradoxical. And it seems to be associated with kind of a chronic low-level infection state, which of course is what TB does. But the pathologic cascade ends up chewing up your lungs, but in BCG it doesn't. And it's one cluster of hypotheses are that the BCG is eliciting a selective pro-inflammatory state that is shifting the immune response profile of your kind of baseline immune system set points in ways that are making your immune system better able to control a variety of cancers. And that's a core concept that cancer is really, if you unpack it, in many ways, it's an immunologic disease because it's our immune system that's keeping cancer's happening all the time in all of us. Right. But it's our immune system that's keeping it down. So the whole...
Well, let me jump in here because I actually have a little background on BCG also, and you're probably aware of this. I did a show about a scientist, doctor in Boston. I'm going to probably mess up her name now because it's been several years, but I want to say Diane Faustman or something like that. Diane, wherever you're out there, if I got your last name wrong. But it was a fascinating story. She was doing trials using BCG vaccine, 2 shots inside of 1 month with type 1 diabetes, and 3 years later, the diabetes goes away.
Yeah.
And what's so fascinating about this story, typical to the things we talk about all the time, and that drew my attention to it was FDA was trying to shut the trials down, and then suddenly the manufacturer of the BCG vaccine she was using shut down. They stopped making BCG vaccine, I think in the country, but certainly in the area she was living in. So she ramped up her own manufacturing plant for BCG so she could continue her trials. And I'm considered an anti-vaxxer, which is a pejorative, and I have, more death, but I decided I would challenge my audience. So the show, I said, the promo for the show was, did Del just find a vaccine he likes? And I brought her on the show. Luckily, she agreed to come on to my show. And you should have seen the hate that she was talking about this BCG vaccine, using it. And first of all, it was lost on a lot of my audience that technically it was being used as a treatment. So it's not really even a vaccine, but that's a different story. But I was trying to get to the question I had for her, and I let her explain how these trials. She was on the 5th or 6th version of the trial, more and more, and she's having nearly 100% success. I mean, really, really high rates of success. So much so that I've run into people with kids with type 1 diabetes and said, see if you get into one of these trials. I think it's really fascinating. Now, I don't know what the long-term effects are going to be, and maybe it has some other thing, but what I said to her is, all right, after she'd explained the whole thing, I said, if this works and you're giving the shots of BCG and then 3 years later, suddenly type 1 diabetes disappears, which is, that shortens your lifespan. We're talking about, and I thought to myself, if I had a diabetic child, I'd be thinking about that. If I had diabetes, I'd be like, I'm going to try it out. In France, they were doing similar studies with BCG and multiple sclerosis, very similarly giving
another
2
inflammatory
shots.
Disease.
And a few years later, 3 years later, almost to the day, I think in those cases, multiple sclerosis disappearing. And so I said to her, is it possible that tuberculosis has a beneficial effect on the human body for some people? And which at that point, half of my audience had already left and stopped because I'm a shill for Pharma, and they finally proved it. But she said, that's exactly what it proves. Yeah. She's like, what we now realize is we have overprotected ourselves. We are using that tuberculosis, she said, is probably the most prolific bacteria on the earth. We have evolved with it. It is a part of our experience. And so now that we're putting Clorox in everything, cleaning our water, we've basically erased it. We're now having autoimmune diseases because we're not having our immune system primed by this interaction with, as you said, like this low-level infection that most people cleared. It was always that.
That's right. It's the low-level chronic infection. This is one of the reasons why, just to kind of amplify this, one of the reasons why you can't take data on vaccines performed in Africa and exclusively include that in your portfolio when you submit an application to the FDA, because Africans have a very different immune response profile because they are out there subjected to all these things, particularly worms. And all of these pathogens absolutely shift your immune response profile.
Yeah.
So I'm fascinated, though, about her making her own BCG. One of the things that Eris learned, unfortunately, they were trying to make recombinant BCG that had kind of even further amp up the protective effect, and that failed. But one of the things they learned was that BCG is really quirky in terms of the manufacturing. It's one of these, it's more of an art than a science. And precisely when you harvest the culture and the way that you handle it really affects its biologic activities. And so you end up with a situation where some manufacturers have figured out the secret sauce. Of course, they don't tell everybody else what they do.
Right.
And their stuff works pretty good, and other ones don't get it right, and their stuff doesn't work so good. And then when you analyze the data, you lump them all in the same pot, and you say, well, maybe it works, maybe it doesn't work. When in fact, within that, you have examples that seem to work really good, and others that are kind of kaput. And it has to do with the nuance of biologic manufacturing. Yeah, BCG is a fascinating story, and it absolutely has a direct socket, as you're pointing out, to human tuberculosis in general, and also to the whole milk story. And a lot of people assert that they can tolerate whole milk, but they can't tolerate pasteurized milk. What a lot of folks don't understand, and this is another benefit, I guess, of having cut my teeth at UC Davis, where they had animal science and dairy science as a major focus. And for a while, I was collaborating with a guy that was, one of the big shots in the milk world. And what they do is they take the milk product, and I actually worked at a dairy for a while when I was a kid. They take the milk product and they completely fractionate it. And then they reassemble it. So the milk that you buy in your favorite grocery store has very little to do with what came out of the cow.
Yeah.
It is truly an ultra processed food. It's carefully managed. All these different components are split out, and then they're recombined to yield something that meets the specifications established by the USDA for milk. And that usually they have all kinds of excess product along the way, casein, lipids, etc. And they split those off to sell them off for other purposes. So when you're getting whole milk, you're getting that's unpasteurized. You're getting a product that's very different from what you can get in your local grocery store.
I saw an interesting. I don't know if you know Sally Fallon, who's last I checked was president of Weston A. Price, that gets a lot into food and traditional foods. Weston A. Price being a dentist that traveled the world and realized every culture has straight teeth because they're eating their ancestral foods. But at the heart of it, she says that, raw milk is literally like medicine, but that pasteurized milk is poison. It is so bad for your body. You gave some detail to that, but I want to kind of stay here because I think that this is something that I think needs deeper conversations, which is what have we done to our society? Vaccinations fits into this a little bit, but raw milk. I know I have friends that are like raw food diet. Like they eat raw chicken, they eat raw eggs, they eat raw.
Truly paleo.
I've tried it out. The raw chicken thing, no matter. I mean, I'm like, are you serious with this? I mean, they're like, oh, it's all media hype, blah blah blah. It's like, well, that hype is still working. It's still working on my brain, but their point is that you want, like, the USDA is removing all the bacteria. The FDA is saying we got to get all the bacteria out of the food, and their point is you want that bacteria. That is feeding your good bacteria. That all the bacteria, like for them, it's like the more bacteria, the better. They would say, I want that tuberculosis.
If I could take this thread that you're developing and kind of let's step back and look at it from above. The USDA has really wrapped itself around the axle of the thesis that they have to protect us from everything. And this fits into this One Health initiative, which is a whole nother basket of issues that's actively promoted in the same way that we've seen the pharmaceutical industry promoted through the American Medical Association. One Health, which is part of Agenda 2030, gets promoted by the American Veterinary Medicine Association. And they played a big role in getting the One Health legislation put in place. So the same dynamics exist in the animal health world that exist in the human health world. And a lot of the same players, the bird flu vaccine that was just authorized by USDA is produced by Zoetis. Zoetis is formerly Pfizer Animal Health. It got spun out, and now it's owned by, wait for it, BlackRock, State Street, Vanguard.
So that was like the mantra of the Kennedy campaign. You're calling up, you get people cheering, BlackRock, State Street, Vanguard. Who's ruining your world? BlackRock, State Street, Vanguard.
So plus in that case, State Farm is the fourth major player. So USDA has had, perhaps even more so because it's less transparent, less visible to people, has been captured by big ag, big finance, Monsanto. I mean, a number of the directors of USDA have been former big shots at Monsanto. Now Bayer, a notoriously unethical German company. Monsanto, the godfather of Roundup and Roundup Ready GMO crops. Which, of course, Bobby gave them a black eye early in his career.
And ironically, right now, since we're touching on it, but I don't want to get stuck here, are trying to get the same liability protection as the vaccine program that Bobby's been speaking about.
I'm shocked.
You know what I mean?
I wasn't aware of that, but why not? Of course
they're like,
we're
spraying on all the crops. You can't grow crops without it, so you got to protect us from all the harms that Robert Kennedy Jr.'s lawsuit's been pointing out.
Which is one of the big issues, right? And among those harms, there is strong data that, to bring this back, that exposure to glyphosate, the chemical name for Roundup, is a link to autism and other neurologic diseases in children, particularly if there's exposure in the womb. And of course, what many people don't know is that Roundup is one of the agents that's used as a, quote, desiccant.
Right.
And so what that means is that when the farmer is growing his grain crop, and this is one of these kind of complex system emergent phenomena stories. So harvesters, combines, are super expensive. We're talking big money. And so the only way that you can kind of afford to be able to field a modern harvester, which is what you need if you're going to be in the grain business, is you have to hire one of these kind of contract operations that has harvesters that they drive around from place to place. And you have to schedule that your farm will be harvested on thus and such a day. So the guy can come.
A pregnancy. It's
the guy,
C-section of
farming. The guy can come in and do his business.
Right.
And he's operating. He's probably in debt to his teeth to BlackRock, State Street, and Vanguard, and whoever else.
Right.
To buy this huge piece of machinery, which by the way benefits John Deere. We can go down that road, but you've got to schedule it. Which means that you can't wait for your crop to naturally dry. You've got to be able to say, on August 22nd, I'm going to be ready for you to come through and harvest my wheat, oat, corn, fill in the blank.
Right.
And the way you do that is that, a week before, you go through and you spray your whole field with a desiccant like Roundup. In other words, you basically kill all the living plant matter.
Right.
And then the grain dries out because it's no longer being fed by the stem.
Basically, deadly poison on all of your crop. Kill it really quickly.
So it's all synchronized.
Yep.
So the harvester can come in.
I knew this, but you're adding an element I did not know that it was. I mean, I always thought it was like, well, to beat winter, which was sort of the generalization.
No.
You're making a very cool. I mean, it's like I didn't know. Sure, the guy's going to be coming through with his combine that I can't afford. That's what he does. So I got to be ready.
I got to have it scheduled.
Wow.
I got to be ready for him when he comes. And the only way you can do that is by using a desiccant.
Right.
So that's how this ecosystem has been driven. And of course, at the top of the scale, of the pyramid and all this, is Wall Street money, because smaller, what? Okay, so really to unpack this part of the story, you got to go back to the 60s and a character named Earl Butz that was head of USDA, and he set ag policy, and he came up with the plan that you have to get big or get out. Earl Butz ended up getting run on a rail because of some really flagrant racist statements that he made. He was a good old boy, but he came up with a logic that was, really supporting the logic that was promoted at the time, that the United States, in its wealth, should feed the world. It was ethically necessary and the right thing to do that we should feed the world. Now, 50 years later, we see the effects of that. We've decimated the native agriculture all across Africa and many other places by pumping them full of American grain and Canadian grain. But that was the logic, is for all the best reasons, we should feed the world because we're able to. And the only way we're going to do it is by endorsing Earl Butz' policy of get big or get out. Yeah. Get big or get out is what destroyed the small farm in the 60s. And when you destroyed the small farm, you destroyed rural communities. You destroyed the small towns. You destroyed a whole culture of tinkering, which is what small farmers do, because they can't afford to buy the big combine. They got to fix the creaky old one that they have, that gave rise in many ways, you can argue, to bicycles, to the automobile industry.
Like Cubas, the cars are all old. The tractor looks like it used to be anyway.
That's the way it was,
tractor,
right? Back when we talk about Make America Great Again, we got to realize that part of the driver in Make America Healthy Again, part of the driver has been this rationalization that in every dimension, we have to get big or get out, that it's appropriate that we let big money dictate our policies and dictate our food supply, dictate the way we live. And it's all driven by the economics of the most abundance at the lowest costs. And when, so I hear stories, as you know, I bounce back and forth between Europe and the States all the time these days, particularly Italy. Italy has really rigorous food safety laws. And if you can get it, Italian pasta made from Italian wheat is a different thing. Italian bread, many people, and European bread, many people don't have, that they think they have gluten-sensitive problems. They can eat European bread. Why is that? Well, it turns out that in America, in order to sustain our baking industry, we allow a additive into the dough that makes it so the dough can be put on hooks and rise. And in Europe, they banned that because it's toxic.
Wow.
And it turns out that material that's in our dough seems to be driving a lot of this gluten sensitivity and GI tract problems. Another case of where we have a contaminant.
We're putting that makes it hang on hooks. And as you're pointing out, the glyphosate too, which I want to, as Trump says, and if I had you for 5 hours, but let's bring this weave back in a little bit, because the glyphosate, as you pointed out, is being used as a desiccant, and this is something that I really think people get tricked on. GMO. First of all, for anyone, just very quickly, Glyphosate's a deadly poison. It was an industrial pipe cleaner,
Yes.
blew all the metals
Yes.
out of the rust out of the pipes, cleaned the pipes. Someone dropped it on the ground, killed everything in sight.
They said,
Hey, let's use it as a weed
"Hallelujah."
killer. And then some genius at Monsanto said, hey, what if we could make plants that don't die when you pour this stuff on it? Then we could dump it all over, it'll kill all the weeds, and it still grows. And
What
that
could possibly go wrong?
Thus, GMO foods, and vegetables and things comes about. But as you're pointing out, wheat isn't GMO. It is just now they use it they just spray it because they know it's going to kill it. They got the combine coming a couple days out or whatever. They kill it all. It's the worst case scenario because now you're using tons of it to kill it. It's the last thing it touches, and then it gets ground into flour and it's covered in this stuff.
It's also our oats.
Yep.
It's all the grains that you have for breakfast.
Yeah.
It's not just the red dye. It's everything that you're eating if you're eating a grain-based diet. It's very, very difficult. You know what's wicked hard to find, by the way, is organic peanuts.
Organic peanuts.
And organic peanut butter. Good luck on that.
Right.
So this logic that somehow safety and quality take a back seat to profit and production, volume, is what's driven us into this state where we're eating garbage all the time, but it's cheap garbage. It can be produced at great, very low cost and great volume. We ship it all over the world, and we're functionally poisoning our children and our population, all sacrificed on the altar of profits for big ag.
Yeah. One of the tricks, just to sort of button up the glyphosate thing, I think one of the big tricks is people see bread and it says non-GMO. Like my kids are thinking in their minds that means good. And I think for a lot of people, they think that means organic. Actually, no, non-GMO on your bread is a trick. It's like, oh, great, it's non-GMO. No, it means that they never protected it and it's been covered with this deadly poison right before they made it into bread. You were eating so much glyphosate in that bread, it's insane. So people that think non-GMO, good, not in terms of your wheat and bread.
And where the rubber hits the road is the peer-reviewed studies that are out now that do things like monitor glyphosate levels in maternal urine. So that's a fancy way of saying in pregnant mothers.
Okay. Yep.
And their urine, because it's excreted in your urine, among other things. And so they're monitoring the levels of glyphosate. It's almost the entire population is producing levels of glyphosate in their urine that are above the known thresholds that are associated with a variety of consequences for the fetus, including neuroinflammation and reduced IQ and a number of other things. Yet another one on the list. Remember all the huff and fuss over fluoride?
Yeah.
And another one that Bobby got pilloried for.
Yeah.
But, we did what we could to put a stake in that because Bobby had the data on his side. And once that kind of came out, then corporate media shut up because they were going to lose that battle. But
why did they never apologize? I mean, like, you got it wrong. Like, I mean, it just disappears like, oh, we're just going to like act like we never covered that story.
It's their modus operandi.
It's so ridiculous.
Yeah. It's all profit driven. Right. And so there's no profit, there's no upside to saying, oops, I screwed up. People talk to me all the time. Oh, do you think that somebody is going to apologize to you for what they did to you in the censorship? And I'm like, yeah, not very likely. I'm not going to wait around for that one. It's just that a case can be made that fundamentally what's happened is that we have embraced profit and monetary wealth at the expense of commitment to ethics, and that this has pervaded society. It's resulted in a society that is kind of morally hollowed out.
Yeah,
it's all about can you get enough. The Bitcoin world is the exemplar for this, and meme coins, right? Can you get an exit and then go live in some version of paradise in Costa Rica or whatever it is by grabbing enough wealth, as opposed to recognizing that that satisfaction and happiness in life comes a lot more from the community and the people that you're interacting with rather than your ability to accumulate wealth, right? The classic biblical saying, what does it profit a man to gain the world and lose his soul? That's what we're kind of talking about, is that as a culture, we have institutionalized gain the future and lose your soul. And so it's okay. There's nobody saying, yeah, but why are we doing this? Yeah, but what about the bigger social impact? You know, I don't want to sound like a liberal, but there's a lot of merit to having a component of maturity and commitment to ethics and recognition that we are a community. You know, I don't want to advocate for socialism, but that as a culture, somehow we need to get away from this purely profit-driven way of looking at our place in the world.
Well, I think we've confused the pursuit of happiness with the pursuit of wealth.
Of money, absolutely.
And you bring up a good point, because I've thought about this. You know, I'm probably going to piss off some of my Bitcoin friends, but I don't see Bitcoin billionaires any differently than I see a lottery ticket winner who have a lot of issues with self-esteem and stuff. Just, you're not looked at. What did you do? Like, what did you create? What did you do for the world? I bet on a, meaningless token that turned into money. You might as well have been going to the gas station, in my mind. I mean, look, it may be a great currency, maybe things in the future, but I'm just talking about like the human experience.
You're not the only one. I was just listening to a podcast driving up here to DC a couple of days ago where two people that are in this space were talking about that and talking about how many of their colleagues are essentially very hollow inside.
What have you done in the world?
Yeah, they're feeling
like you've pursued trying to be a truth teller. You've done experiment. You've done science. You've done all sorts of things. I feel. I mean, it's nice to have some money,
but
I have a mission. I have a
no
reason
one can
I'm alive.
deny, Del, that
right?
you have had a mission, and by God, you've been committed to it.
Yes, indeed. As crazy as it may be, I feel like we're like an hour into this, and I've made the biggest mistake in media, which is I'm assuming everyone knows who you are, right? I mean, like you kind of are magnanimous now, but very quickly, one of the inventors of the mRNA technology.
I was okay, Del. So
vaccine.
I appreciate this narrative. It's a defensive position, so that you don't get attacked by the like of Berenstein, as I have, for saying these things. But the honest truth, and it's documented on our website, is I came up with the original ideas. I wrote the original patent disclosures.
Yeah.
I was intimately involved. I was the primary person in reducing it to practice, and I am the bona fide original inventor. Why can I say that? Okay, then the academics like at Scripps went nuts over attacking me.
Right.
Oh, there's 500 papers on RNA vaccine, and you've only got 2 of them. They happen to be 2 of the most important and the original ones.
Right.
But you're not the inventor. All these other people are just so much the inventor. Inventorship is determined by the U.S. Patent and Trade Office. Okay, it's not something that academics determine based on how many peer-reviewed publications you get. That's promotion and tenure. That's a different thing. Okay, but when I say I'm the inventor, I got the documents. I've got the artifacts. They're on my website. You can see them. And all the journalists that attack me, like Davy Alba from the New York Times, who came up to my farm and actually refused to look at that documentation before she wrote her hit piece for the New York Times, are willfully blind. It's there. And furthermore, I get attacked by various people that I won't name all the time as a mass murderer because I had these inventions.
Like, I invented this
when I was
just killing millions of people.
Yeah, when I was 28. This all happened when I was 28, 29, 30 years old. And then I continued to pursue it. I could never overcome the toxicity, and I abandoned it.
Do you have any guilt?
No, I have. My conscience is clean.
Really?
Yeah, my conscience.
I mean, because this thing, from some perspectives, is incredibly devastating. We could go into all the ways this thing seems to be perfectly designed at killing
daily.
people in a myriad different
almost
ways.
Daily, the additional data developed. Now there's a new paper about renal disease and excess mortality.
Yeah.
The
Blindness.
data, data just keep coming about this. But I had nothing to do with this vaccine. That's another thing that amazes me is all these folks are busy shooting me. It's another circular firing squad. When, as Bobby said, if he's controlled opposition, I want another 100. But what they totally overlook the 6 people at NIH that actually built these vaccines,
right.
And had no problems with putting spike protein into them,
Right.
and now are all basically getting an extra $100K per year for the rest of their lives because of the Bayh-Dole Act profit sharing that they've got in place with the NIH. And NIAID is getting God only knows how much extra money, but they're all shooting me. I had nothing to do with these vaccines.
You're like in the worst case scenario, right? You get none of the credit for the genius of even thinking of it, and you get it blamed for all of the harms that it's causing.
So I had friends back from the day when we were doing all this that were working, adjacent to me. That there's in the Atlantic Monthly hit piece that they published early on, Dr. Malone, vaccine skeptic, and they had 2 syringes like skull and crossbones in front of my face. They interviewed a guy that I knew back in the day, Stan Gromkowski, who is a hotshot immunologist, really accomplished, and he insists, and he's a little salty in his language, and they wanted a quote from him, and he insisted that if he was going to give him a quote, it was going to have to be verbatim, and his quote to them was, "I don't know what he's doing. He's fucked up his chance to get the Nobel Prize." It's from your lips to God's ears, that absolutely the Nobel Prize committee had to do backflips to give it to Carrico and Weissman for their work building this particular vaccine, which they didn't actually work on. The work was really done at the NIAID.
And if I'm correct, their genius was how to make the mRNA last longer, slip in a pseudouridine. Is that right?
So if you go back, and I know about this because Katie Carrico called me about a decade when I was at Davis, a decade after I did the initial work. She called me and asked for advice because she wanted to work with RNA. And I told her what the problems were. I told her who she could talk to. I invited her to a meeting that we held on this in Baltimore.
Yep.
And she together with Drew Weissman, who is a Tony Fauci postdoc, came up with the addition of pseudouridine, but they did it to reduce the inflammation associated with the mRNA administration together with the cationic lipids. So they didn't actually do it to make the RNA last long, and we now know that it does so.
Forever.
And the spike protein.
Let me not exaggerate, but as long as the study lasts, it looks like it's still producing.
It's still there. And what they did was they took some breaking research in the RNA world. That's the insider phrase for this is RNA world. So the people that do this kind of stuff and all talk to each other, they consider themselves part of the RNA world.
Okay.
And they took some of the kind of breaking information at the time that was just barely out about this molecule that had been identified in natural RNA called pseudouridine that seemed to have some effect in reducing inflammation associated with RNA or in cells that were producing more of this pseudouridine. And they said, well, that seems to be the problem. Why don't we put it in there and see what happens? Mm-hmm. And at the time, and still in the present, the real biology of pseudouridine was hardly even begun to be understood. And of course, the FDA didn't help any matters by asking, well, why don't you figure out what this is really doing? They just kind of said, oh, good, works, let's go. And don't ask any questions. And it turns out that as we've learned over the last 4+ years and even before, and the science is still not settled on pseudouridine, by the way, but this natural molecule that is incorporated into RNA in very precise places in the natural state. When you jam the whole molecule full of this stuff, you get other effects that were unanticipated. And one of them is those very long lived molecules that my original idea was, hey, what's wrong with, I was working in a viral vector gene therapy lab. Yeah. And the problem with that is that if you administer that gene therapy and something goes wrong, you can't like go in, the surgeon can't go in and cut out all the cells. You're stuck with that problem. And that's only one of the problems with traditional logic of gene therapy. Another one is that the foreign genes your body reacts to as if they're foreign antigens. It doesn't know that they're the good gene. It just knows it's a different gene. So the immune system is a problem, which is why I thought about using it for vaccines. But that's part of the story.
What part of the genius was it wasn't lasting long enough to fully insert is that right?
That was the idea, was that you could use it as a drug. That was the original patent disclosure.
Right.
Was RNA as a drug. Okay. So you could put it in the cell, it would be there for a short period of time, it would produce a therapeutic protein, and then it would get degraded, be gone. And if for some reason there's a bad effect in the patient, you just don't dose them anymore, just like a regular drug. So it opened up a whole new category of molecules. And by the way, boy, did I get hammered for that one. That was not well received because it was way out on the edge, and really disturbing the dominant paradigm.
Yeah.
And I was working in one of the leading gene therapy labs at the time, basically coming up with heresy. So that didn't fly very well. But eventually I had a nervous breakdown. But that was the idea. And then the pseudouridine modification basically took that concept and I don't even think in the original patent, they don't talk at all about vaccines. I don't even think they were thinking about vaccines back then. They were thinking about cancer. But I don't even think they were aware of the logic of using RNA that I had promoted.
Yeah.
That it was a form of transient gene therapy that you could elect not to redose if there was a toxicity.
You liked that the immune system would attack it, degrade, as you said, come in, and wasn't that like as a vaccine? That's perfect. It's not there too long to cause autoimmune disease.
Well,
I get a reaction. It's out of there.
Better than the logic was it was better than giving somebody a live attenuated virus,
right?
With all of the extra stuff that comes along with the whole virus. So the logic was basically the way it was set up, coming out of my brain was, okay, gene therapy has a problem. It generates an immune response. Oh, we can make lemonade out of lemons. But we still have the problem that if you're going to use a classic gene therapy technique, by the way, the ad vectors in J&J and the other AstraZeneca products. Yep. That tech was developed by the senior postdoc in the same laboratory at the same time I was there.
Wow.
Dinko Valerio. And he wanted to use ad vectors for gene therapy, and they tried that. It didn't work out so well. And he came to me a few years later at a meeting, and he said, Robert, you got the right idea. We're going to take my little company, Crucell, that we've created to develop adenovirus vectors, and we're going to turn it into a vaccine company. And that was bought out by J&J, and that's what gave rise to this vaccine. So it all traces back to the same place. But, as I said, the logic was gene therapy wasn't going to work. So my whole vision that I was going to be a pediatrician that would treat chronic, genetic inborn errors of metabolism in these poor children with cystic fibrosis and sickle cell anemia and all those kinds of things.
That was the dream.
That went right out the door. And then what are you going to do? And I had some background in vaccinology, and then I had these insights. And so the idea that you could make something that was more like a live attenuated virus vaccine without the risks of a live attenuated virus. Like, for instance, yellow fever is a live attenuated vaccine. And it's not that attenuated. If you make it more attenuated, it doesn't actually work very good. Okay, so you need it, the slang is you need it hot. And if you, I did a consulting gig down in Brazil for a while involving vaccines. And so they had a story there about their yellow fever vaccine campaigns, because in Brazil, the wolf is at the door. I mean, yellow fever is not a hypothetical. It's there in the jungle, waiting to come and bite you. And you're pretty motivated to not get bitten by yellow fever. That's a nasty disease. It'll kill you. And people would, there's we could call them peasants or poor people, or they're jungle people coming out of native cultures that haven't had the benefit of a Western education, choosing my words. So they would have these vaccine campaigns for yellow fever. These people would go get their yellow fever shot, and then they would say, well, if one is good, two is better. They get back in line.
Wow.
And they get another shot and kill them. Okay? That's the nature of these hotter, live attenuated vaccines. Is it's just a question, like everything, of getting the dose right. And if you exceed it, it'll get you. So the idea was you get the benefits without some of those risks.
Yeah.
What's not to like? What's overlooked is that one of the other key discoveries that were made right about the same time, I think I was 29, maybe 30 at that point, at this company called Vical, was the negative control. Yes, I used to do negative controls, unlike much of the industry.
If we could get you back into the
and
CDC,
the negative control of the RNA without the fat part, without the positively charged fat globs, actually worked better for producing protein in a mouse model. So that gave rise to this seminal science paper that at the time, it was published about the same time. Remember cold fusion?
Yeah.
So cold fusion was out and everybody's like, nah, that's not going to happen. But they made a big deal about it. And then it turned out to be misinterpretation of their data. And everybody thought that this naked DNA and naked RNA paper that we put out was going to be another one of those that was a flash in the pan. And it turns out that we just didn't know what we were doing. But it's been reproduced all over the world and has a huge number of citations, and it works. And there was a company that was advancing this tech, and in particular not using pseudouridine, that was funded by an obscure investor named Elon Musk called CureVac. And in the race for the COVID genetic vaccine product, CureVac, to my eyes, did it right. They did more rigorous, methodical dose escalation studies, and BioNTech now sold their stuff to Pfizer, so it's BioNTech, Pfizer, and Moderna kind of went for the grand slam. And they dosed their animal models initially and then their human trials with really quite high doses of this stuff. That's been one of the problems, is they overdosed it. Whereas CureVac kind of did it more methodical, dose escalation.
Found the sweet spot.
And, well, they never got there because they disclosed their initial results at a lower dose. And everybody else at the same time came out with their high dose results. And the antibodies... Now, you're now at a point where you understand that just because you got antibodies, it ain't necessarily saying that it works.
Right.
Okay. But that was another one of the lies that were sold to us.
Yeah.
And the antibody titers were higher when you got the dose higher. Now, if you adjusted for dose, they're about the same. Okay. But in the kind of media narrative that got pushed, that guided
more is better
government decision making and big money.
It's a bit like getting in line for the yellow fever vaccine twice. Like it's more is better.
But what could possibly go wrong, right? And so that that remains a undeveloped thread. And CureVac tried to fight the patent battle, and they've largely lost. And they're going to be constrained to the dustbin of history. Is
there a place for mRNA? Because it looks like there's this tidal wave. Everyone wants it in vaccines.
I've had this question so many times. The first time I had it was...
Well, let me move to a quite different question. I want to be boring here.
Let me just give you because I've come up with a glib answer that is my go-to now. And the usual version is, can mRNA be safe?
Yep.
Okay, as a technology. And my answer is, pigs could fly if they only had wings. We can speculate that this could be done or that could be done, and then you would have to do the studies and see if that's the case. But anything's possible. Right now, I don't see safety. And oh, by the way, Del, the rumor is, I haven't seen it in writing covered by the press, but the European Union has now authorized a SARS-CoV-2 or COVID vaccine using the self-replicating RNA technology that was first licensed in Japan. So this is another iteration on this that is even more concerning.
Mm-hmm.
And the EU, in its wisdom, is all in on this because there's people there that are advancing that technology, manufacturing it. It's got the whole commercial thing going for it. So when I saw Science Magazine, John Cohen covered the bird flu vaccines, and there was some other articles about these, this new push for mRNA vaccines for bird flu.
Yeah.
And the statement was made that these current round of vaccines were using traditional mRNA technology. And I just gagged at that.
So we've already got, modern and traditional. Do you believe, because, I mean, do you believe that some vaccines are good?
I think that, so for instance, some of these, like yellow fever, is an example. I think that the another one of my cute little phrases, you give a 3-year-old a hammer and everything becomes a nail.
Yes.
And there has developed this kind of vaccine cabal cohort. I could name a couple of prominent names of academics. Peter Hotez comes to mind.
Yep.
Paul Offit comes to mind.
Yeah.
People that have vested financial interests and career interests in the logic that, and there's many of them. They just are the tip of the iceberg. People that have bought into the idea that as Tony Fauci said, when presented with data on vitamin D and influenza, he said, no, we treat flu with vaccines. There is a logic that it relates to the Overton window, the range of acceptable dialogue in this space, that you shall not talk about certain things. And there are certain truisms that everybody that is an insider on the kind of the cool kids club that gets all the money and controls the decisions and sits on the advisory committee on immunization practices and the FDA advisory committees, et cetera, they all have to kind of buy in to be part of the club in certain assumptions. And one of them is that you treat infectious disease with vaccines. That's the way it is. And it is so stupid because I think there are places for certain cohorts. I think you really have to age stratify. You have to stratify by pre-existing conditions, and you have to look at the context, but this idea of everything becomes a nail, that, and we recently had Paul Offit come out on a podcast. I don't know if you caught that. Paul Offit is busy trying to throw Tony Fauci into the bus at the moment and say that it was Tony Fauci who was responsible for the decision
there was a select group
to
just
jab
for the elderly.
everybody,
right.
as opposed to age stratify it.
Kind of did the same thing with AIDS, by the way, too. He
just
really
kinda,
wanted, you know what I mean? Kind of just said everyone's at risk.
And remdesivir and AZT, and he's got this long history of hitting everything with the same hammer and not respecting the nuance. And when you unpack what Offit reports, whether or not it's very convenient for Paul Offit to say this. He wasn't busy objecting back in the day. But I'm sure he could pick up his phone and talk to Tony Fauci any day of the week at any point in time. As one of the most important vaccinologists in the United States, because he basically redid a vaccine that was causing intussusception.
Right.
And a case can be made that what they really did was cook the data so that they didn't get the adverse event that they picked up in
By
the
the
prior
way,
one.
I mean, you're talking about the rotavirus vaccine, and intussusception is sort of like your intestines,
Fold onto
fold
onto themselves.
onto
Yeah.
themselves. It can be deadly.
Yeah, you get obstruction.
And Paul Offit was on the advisory committee of immunization practices for the CDC that approves and recommends the vaccines for the childhood schedule. He was on that committee, did not recuse himself for getting a rotavirus vaccine onto the schedule while he was making one, had a multi-million-dollar deal.
And
It's
getting
one of the
patent
greatest
revenue.
examples of,
Pretty much in your face.
Pretty much in your face. All right, look, you got to go. We're all very busy. I want to thank you for taking time. I have one more question, very important question. Do you work for the CIA?
Okay, so I could make a joke out of that, and then that would be clipped and become a something on TikTok.
Yeah.
I do not. I never have. I have had secret security clearance through the DoD. You cannot be working, and there was a point in my career where I was out of a job, basically run out of academia because I had blown the whistle on the Jesse Gelsinger gene therapy death at UPenn, and was behind a lot of the press coverage in that, helping the press to understand what had happened. And I got a job. A friend at the state of Maryland pointed me to a job at this new startup in Frederick, Maryland called Dynport Vaccine Company that had just received the DoD contract for all biodefense, basically vaccines and therapies. And so I went there as a associate clinical director. And as a consequence, that's when I really learned the whole biodefense space. But you can't be in the biodefense space without rubbing elbows with CIA people. And one of those CIA people that I rubbed elbows with was the commander of the program within Defense Threat Reduction Agency that managed a lot of the biodefense portfolio. And when he retired, I actually started a company with him, Galloway and Associates. He still hates me and he writes me, the other day he wrote me an email, I really enjoy your Substack, but I really am pissed off at you because you mentioned my name in Bobby Kennedy's book, The Real Anthony Fauci. The other one, so I people accuse me of being CIA, and they don't realize how much risk I took in actually naming people that are CIA, not something you're supposed to do, that were involved in all of these various nefarious activities that we've all experienced. And one of those is Michael Callahan. And I published with Michael Callahan. Michael Callahan was a CIA officer. He has advised at least 3 presidents. He was one of the guys at the top of the food chain, holds a position at Harvard Medical School. And he was the guy that called me. It's unclear. Was he on the way to Wuhan? Was he already in Wuhan? I also got threatened by one of my former DoD colleagues for mentioning Michael Callahan and saying that he was in Wuhan when he called me on January 4th of 2020 to say that there's a novel coronavirus afoot and you better get a team spun up to address this. And, I've been open and transparent about all this stuff with the public. And then there are people that weaponize that as evidence that I'm controlled opposition, I'm a bad guy, et cetera. They don't realize that I took a lot of risk in disclosing these things that I know and continue to disclose. I did have secret clearance. Now, the things I disclosed were not classified at the time. And so I kind of had to think about it. Am I okay seeing these things? And I thought I was.
Are there things you're not saying that you know? I mean, you write a Substack every single day. I know your wife Jill helps.
I've gone as far as I can in talking about what I know about the history of the biowarfare industry in the United States, and I'm right up on the edge of what was identified as classified, and I've disclosed it, what I knew, because there was some other public disclosure. So then I could say, well, it was already in the public domain. But one of those is that we've been talking about molecular virology, molecular biology, immunology, these sciences that the United States has led on globally.
Yeah.
A big reason why the United States has led on that globally is because the investment that the United States government made in biowarfare research, I was told, is larger than the investment they made in thermonuclear weapon research.
Wow.
Okay.
I believe that too.
And the head of the American Society for Microbiology for very many years was one of the top guns in the biowarfare complex. And Bobby covers that industry in a way that I didn't even know until I read the Lab Leak cover-up book, the second one in the series, where he talks about the history of Fort Detrick and importation of the Japanese biowarfare specialists that were so nefarious into what they did in Japan and with the Chinese. So that's what I have disclosed in that space. And then the other complication I have is that I've been a consultant for decades, and I have a string of non-disclosure agreements.
Yeah.
And so, for instance, I had this client that I've talked about, Behavior Matrix, that developed a key tech that was used in Arab Spring and the color revolutions, having to do with social media manipulation and mapping. And that there was compartments of that that were classified and still are. And I haven't gone there.
And a tool that clearly was probably utilized by CIA or anything.
Is not was.
Okay.
And has been integrated. When I talk about, this is the basis for my, the starting point for my work in psychological warfare. And I've published the non-confidential slide deck from that client, which no longer exists. It got bought out. On my Substack, but I haven't talked about the classified part of that. I can't.
Right.
Be breaking the law. So there's my answer to you. No, I haven't said everything I can, but I've said as much as I can, and I've tried to say it in ways that provides the breadcrumbs so that people can infer the rest of it. People these days are pretty good with conspiracy theories, and if you give them the breadcrumbs, Hansel and Gretel being the metaphor, they'll usually figure out where the house is. And so probably so that's, Callahan is still out there. I was told the other day by somebody who is a federal investigator that has a link to the government side of MAHA that hasn't been announced yet.
Yeah.
That Callahan is now very focused on the whole super soldier, augmented human being, transhumanism world. So I lost touch with him. I basically turned my back on him. He lied to me. I'm pretty convinced that I got used early on in promoting the false narratives around this, and it pissed me off pretty good. And things like when I raised with Michael that it looked like this. I was doing sequence analysis like starting January 10th of 2020.
Yeah.
And I raised with Michael, this looked like it was an engineered pathogen. And his comment was, straight out. These guys are really good at lying. You got to understand, if you're dealing with anybody in the intelligence community that are operatives, they are trained liars and trained psychological manipulators. That's what they do, the field agents.
Do you think you can pick one out now? I mean, someone said to me, Del, you've got to be surrounded by agents at this point. People around you, people you're talking to.
It's highly probable.
The work that you do, you've just got Bobby Kennedy into a position no one wants them.
That your cell phone and your data infrastructure are compromised.
Yeah.
With things like Pegasus 2, which you can't track. I've had people that we both know that when Jill and I turned in our old cell phones and got new ones, suddenly they came out of the woodwork and really wanted to interact with me and wanted me to answer their emails. Well, that's when you get a ping and then you respond, that's how Pegasus 2 gets loaded in. And they've gradually gone away. These people are absolutely out there.
Yeah.
And anybody that's in our space, you kind of have to assume that you are interacting with them at one point or another, usually surreptitiously. So these are the chaos agents, and they're the ones that they so want to work with you and collaborate with you, and you know you're like,
Tell you how brilliant you
yeah,
are.
precisely,
Right.
yeah, absolutely.
Yeah.
You know, it's not just the honey trap with the short skirt. There's all kinds of ways to gain the confidence of somebody, and flattery is one of them. So it makes it a weird space where you always are second guessing, and it makes it. You know, I talk about this in the Cywork book. Once you enter into any of these spaces, and now it's all of us on any media platform at all, we are being manipulated 24/7.
Well, I mean, I say all that, and just to wrap it up, you know, you're one of those people that I was warned, am still warned by many people. I've lost, I mean, I run a nonprofit. It's how I've done most of my work. I have lost over $1 million in donations from large donors that said, if you ever interview Robert Malone, you know, he's proven to be CIA or whatever. I know you deal with this. I know you've talked about, but I want to make this clear for the audience that's listening. You know, how I handle that. And the truth is, and you're a perfect example. When you came onto the scene, that there was I first saw you on Brett Weinstein's podcast.
Very good.
You know,
Yep.
and
that was the breakthrough one.
Yeah, it was really a breakthrough. Steve Kirsch.
Yep.
I think a lot of people are like, Steve, hold on a second. This other guy, we want to hear from him. I love Steve, but you know. Here, I say it, I've had to say this recently because there's always people in my space, or why are you interviewing them, or don't you? I'm sure I have had people on my show, The High Wire. I'll probably have someone sit in this seat at some point that is working for the other side. I don't know how I'm going to figure that out. I would need a massive investigation team. As you pointed out, they're really good at what they do. But this is the criteria I go with. I just assume you are CIA. I just assumed from the beginning Robert Malone is, let me just say, he's CIA. When I have been working on this vaccine issue, I've been trying to get people to recognize that we are not doing proper safety trials. These things are being rushed on the market every time. I had a team of scientists, you know, once I made vaccines on CBS.
You've done a great job,
you know what I mean?
To say you've done a great job just documenting things.
Right.
You are one person who doesn't go off into the purity spiral space of speculating this, that, or the other thing.
No.
You come up with the evidence and the artifacts.
I only state what I can prove. Every once in a while, if I go into, like, you know, I have a hypothesis, but let me be
Aaron
perfectly
Siri
clear
also
about that.
deserves
our lawyer.
Really, and the journalist that you work with also is very committed.
Jeffrey Jackson's amazing. But just, you know, when I was looking at what you were saying, and for those of us that were trying to get this story out, I said, I have known that they want every adult lining up for vaccinations without question. It is, you know, whether or not it's, what I know is it is a perfect delivery system for whatever control you want on humanity. I don't know that people kill. I don't know there's eugenics, but if you ever wanted to be able to control society, we've already seen sterilization programs through vaccinations that have happened. We sterilize deer with vaccines. So it's not outside the realm of possibility that large countries that are worried about finite resources might one day want to be able to just say, you get this one, you get that one. We're all showing up without question. It could be used that way. So that's, you know, one of the things that I know is out there. But I knew as I started investigating it, they want every adult lining up. I've said this is the cash cow. This is the gold rush for pharma. Don't listen to them when they say that vaccines don't make you any money. They're now the second, third highest products, and they're just getting started. If mRNA comes as a tidal wave, they can start vaccinating for every bacteria and virus on the planet. If they can convince you, get the government to mandate it, we're going to be human pincushions, and these companies are going to go from multi-billion-dollar companies into trillion-dollar companies. And all that said, when the COVID pandemic, when it became clear to me, I'd been saying there's going to be a pandemic. They've got to get all of you to believe you need a vaccine. It's not about the kids already vaccinating them. They want you. Yeah. The 70 million kids isn't enough. They want all 340 million Americans lined up constantly over and over again. Look how many COVID vaccines they're getting. But I saw it coming, and I just thought, I know our government, CIA, whatever, wants everybody in a mandated vaccine program. I know that they want my cell phone to be a vaccine tracking system. I know they want me to not be able to get into a restaurant. I know I've seen it all coming. And here's this guy, Robert Malone, that the CIA has apparently sent in. And in their infinite wisdom, right at the moment where we've got everybody terrified of this deadly virus that's sweeping the world, and we've got everybody lined up to get this vaccine. We're going to finally get the vaccine program ramped up. People are lining up. You know what we should do? Let's find a guy who could arguably say he invented this vaccine and get him to say, don't go near it. I built it. It's deadly. It's going to kill you. I'm sick now. Look out. And I'm just thought, if that's a CIA play, I've run through it.
That is 5-dimensional.
I mean, these guys are so deep. I mean, if that's a chess move, I just said, I'm going to roll the dice on this. If that guy's CIA, I believe I can do more damage with what he's saying to this insane and what appears to be a dangerous vaccine than whatever plan I don't understand that Robert Malone has going on or what he's up to. You are not going to undo. I'm going to get millions and millions and millions of people to stop taking this vaccine on what Robert Malone is saying alone. And if that's CIA, as Robert Kennedy Jr. put it, I will take CIA agents to work with every single day, line them up, bring them on.
And the truth is that I have been trained in bioethics, and I made a personal decision to change my career from being an academic chasing the golden calf of peer-reviewed papers and to advanced development, regulatory affairs, bioethics, project management, clinical research, ethical clinical research, et cetera, et cetera. And I spent about a decade retraining myself for all that stuff. And then this thing comes along and they break all the rules. And it's headed up by Tony Fauci, who I've seen my whole career act in ways that if I did it, I would have been banned from doing clinical research. And it pissed me off. It pissed me off that my industry and all the things that I'd been taught was the right way to do things were just thrown into the trash can by Peter Marks and Bob Kadlec, who, by the way, is intelligence. Michael Callahan's old boss, who was the Assistant Secretary of Preparedness and Response under Donald Trump, reporting to Secretary Azar. Okay. Yeah. I didn't like it very much. And I was not going to just sit by and let these guys have their way with all of us. I was going to, I'd already, as I said, I've already destroyed my career once, my academic career, by speaking out about what I knew concerning the gene therapy death of Jim Wilson and UPenn. The Jesse Gelsinger death.
Yeah.
And strangely, I'd been able to recover because people respected that you stood on a position of ethics and truth. And so when this came around, it was, I think, easier for me than for some. Also easier for me because I didn't have any debt.
Right.
And it was easier for me to say, no, this isn't right. But still, I've mentioned this before. Right before we did that podcast, Brett turned to Steve and myself, and he said, if we do, Brett has he's another one who can see over the horizon. Brett said, if we do this, your world is never going to be the same again. And Robert, you will not get the Nobel Prize. We all thought Steve was going to have the best of it because he had his own company. In the end, his board of directors kicked him out. Okay. And it hurt him more probably than any of us. Brett got demonetized from YouTube, not for the sin of talking about the vaccines, but the sin of promoting ivermectin.
Wow.
And the rest is history.
Yeah.
And then I went on, then things go along and I'm taking all these hits and stuff, and the corporate media is after me. And then I go on Rogan and boom, God bless his soul.
Yeah.
And by the way, I have not heard a peep from Joe Rogan or his people since. And one of the fascinating things that came out about that story was that it wasn't Neil Young. Remember Neil Young said he was going to get off Spotify? It wasn't Neil Young that caused all the problems.
Really?
It was Coca-Cola complaining to GARM, the Global Alliance for Responsible Media, that's basically a WEF affiliate, right? And GARM has the socket for things like AdSense that drives Google profit.
Yeah.
And drives the control of advertising revenue all across the world. And GARM, Coca-Cola, according to U.S. Congress report, it's out there, okay, that I gave this thing, they already were scared silly of Rogan because he's, my wife now calls it dead media. Not even legacy media anymore. It's dead media.
Yeah, I agree with her.
They knew they were dying. Joe Rogan was the threat. And now he comes on with this guy, blows a hole in the whole narrative, and he's got to be punished. And it was, I don't know why Coca-Cola decided that it was their job in the world to initiate this, but they, according to Congress, that they were the inciting event. And then they pushed GARM, and GARM pushed Spotify and said, you've got to get rid of Rogan. Because he's done this horrible thing that is going to lead to millions of deaths. This is the narrative that this is the other narrative that I'm a mass murderer. I'm a mass murderer for having done something at 28 and had this brainstorm and these insights. And I'm a mass murderer because I caused people not to take this
carnage everywhere you go.
Fantastic vaccine that is absolutely safe and effective, right? So what a weird world.
Robert Malone, I want to thank you so much for taking the time. I want to thank you for your friendship, your guidance. A lot of people don't know how often we talk behind the scenes.
Thank you. That's good.
You have, pointed out, things that we need to look for. I know that, whether or not you're directly inside, Robert Kennedy Jr. has leaned on you many times. They're very important. I hope he leans on you more in the future.
I did get a call from him the other day.
I'll bet you did. I'm sure of it. I have told him you better get that guy in somewhere to be helping.
He wanted my point of view on bird flu for some reason.
Yeah, I don't know why. It's only the next great thing. I'm sure we're going to have you on this podcast again.
Oh, it'd be my pleasure.
Thank you for your Substack. Where do people find the Substack, just very quickly?
We've renamed it as Malone.news to get outside of the Twitter algorithm using the name Substack. It used to be, if you could go on Substack, you would search for Who is Robert Malone was the title. It was kind of a play on words and a reference to Ayn Rand, who's John Galt. But that seems dated now. So we just call it Malone.news.
Malone.news.
That's what we do for a living.
Keep up the great work. You're super fascinating. I love the storytelling. You've got such great insight, and you're really needed right now in the MAHA movement. I think you're a big part of it, and we look forward to working with you in the future.
Thank you. That's kind and heartwarming. I appreciate it.
Take care.